Hello and welcome to day 4 of our 7-day series More Than Medicine. Today we're going to have three very interesting people, Dr. Nia Sharikadze, Dr. Vakhtang Tebidze, and Dr. Tiko Muradashali. All three of them have been involved in oncology and hematology in their own way. And first, we'd like to introduce Dr. Nia Sharikadze. She has been my teacher and a very interesting person. Thank you so much for joining us today.
Thank you for invitation, Lekha.
So for everyone listening, could you tell us a little bit of yourself?
I am a medical oncologist and I am a head of the oncology department at Muradashvili Medical Center. I joined to this big oncology team 2 years ago and my oncology practice started from 2000 when I joined from hematology to oncology, clinical oncology group. And it was pretty interesting because hematology, as you already know, it's a pretty wide specialty. It includes not only oncology, hematology, but the routine normal hematology, abnormalities, the routine hematology diseases. And it was pretty interesting and pretty excited me when I continue working with solid tumors. Um, it was not easy because hematology patients are pretty severe. And in 2000, 20 years ago, in Georgia, level of hematology was not as high as nowadays. And we started from zero. We started to implement new protocols, new guidelines, international standards of treatment, standard of cares, and I am pretty happy that we built pretty big, well-known oncology group. And nowadays, I surrounding with many young oncologists, which are pretty well educated. And now it's much easier to be self-trained than 20 years ago in Georgia.
Definitely, I can
And
imagine.
I'm pretty happy from my specialty, despite that it's pretty controversial. We have the bad days, we have the nice days. Sometimes we fail, and it's pretty hard to me. But in most cases, we win. I am pretty optimistic. Otherwise, it will be very difficult to be oncologist.
Definitely, I can
We
imagine.
see, uh,
So when
yes,
I so when I was in 10th grade, I had this great fascination for oncology. I wanted to know why there was this pathophysiology that we couldn't explain. I wanted to know so much about it, and that time I was looking at it more of a scientific research perspective. And then when you come to clinical years, you end up seeing how real it is with the patient and how long you need to kind of be strong for your patient, for their diagnosis, etc. So, 20 years ago, when oncology wasn't such a big field, what made you kind of gravitate there?
really, 20 years ago, I met my ex-mentor, David Tabagari. He was really pioneer. He came from Russia. He was very modern people. And we started with implementation of clinical trials. It was
Right.
necessary at that time because many new drugs was absolutely impossible to get for our patients because it was unavailable and it was pretty expensive and no chance to patients to get the novel gold standard of treatment.
Right.
So started with international randomized clinical trials. It was one of the best chance for our the patients. And we started with clinical trials. And what's the interesting that 20 years ago, I started with first oncology clinical trials in Muradashvili Medical Center.
And then
It
you came back.
was, yeah, after 20 years. But that time I was not an oncologist, but
You were a
I
head.
was a clinical research association from this side to manage and monitor safety of clinical trials and the level of the clinical trials. I mean the good clinical practice. I know that you are already aware about GCP,
Yes. Yes.
and it was pretty interesting. And from that time, we are very close friend with my head of the clinic now, David Riniashvili. And that time we think about the new clinic, multi-profile clinic, which really help our oncology patients because we're a
So,
very small country, we're not rich country, so we need to be very close, all oncologists, and
right.
like big tumor board, and to make decision together for our success patients.
So from what you have told me, you mainly see a lot of patients. Sorry, you've been involved with breast cancer, lymphoma, lung, colon cancer. What would you say is the biggest barrier in providing treatment for your patients?
Money.
Money.
And that's why I am pretty actively involved as an expert in oncology to manage the possibility of getting the drugs. So,
Right.
and one of the great success program is from 2016, when we first with whole of Tbilisi, we city hall of Tbilisi, we started the big project to provide our patients with one of the expensive drug, trastuzumab, and you hear about the Herceptin.
HER2
And
new.
yes, and the Tbilisi City Hall provide with the manufacturer Roche, together. It was the complex project to provide for Tbilisi citizens, women with HER2 positive breast cancer, early stage, uh, free from charge. It was partially recovered, but it was a big success from the government. Then Ministry of Health was involved in this project. And one good story, I have two patients, two sisters. One was diagnosed 12 years ago with HER2 positive breast cancer, and she is still covering the credit for trastuzumab during 12 years. And the next second sister diagnosed 2 years ago, and she was lucky. Government practically fully covered this drug.
Amazing.
So this is problem of one family, two sisters, and both are healthy and both are alive. And that's why I am so glad to help my patients to get modern standard treatment nowadays in our small country, Georgia.
That is so inspiring, Dr. Nia. I like the fact that you were talking about women's health and breast cancer. So another cancer I wanted to ask your opinion about cervical cancer. You know that now it's been proven time again that HPV vaccination or just regular screening can prevent cervical cancer. So what do you think is kind of the barrier for that? Why do women kind of shy away from getting pap smears, or what is how do we improve screening in gynecological cancers?
Leka, thank you for this very sensitive and good question, because several years ago, 700 vaccines was damaged due to the invalid data, expired data, and this was lack of knowledge between the, I don't know between which specialty, mainly with the gynecologists, with primary medical care doctors, with pediatricians, because as you already know, the vaccination with anti-HPV virus started from 11 till 13, or like before the sexual life started.
Yes.
And 700 vaccines has expired the date of use. So, but from the time, uh, population was increasing knowledge. So we try and we did our best to give the knowledge to primary care, health care doctors, to the gynecologist, to the parents, that it's necessary. You can prevent this severe disease, because I saw a lot of women with spread of disease, and we are absolutely unable to help them, despite of radiotherapy, despite of the surgery, despite of the chemo. When the disease is expanded, it's absolutely incurable, and we are not able to save lives. So we have our examples. I plan to vaccinate my granddaughter. She is 9 years old, and nearest future I'll vaccinate her. And I promote and I ask and explain to everybody it's necessary,
I will
because,
let
as you
you from
already know, yes, and in US they already started to vaccinate the young generation of men. So
right,
we can save life, and we had many discussion about the primary prevention
right.
of
I would
the
like
cancer.
to give you
It's
some
a
good news
best.
that some of our students in USMD, we had to do a kind of like a community project. And four students, Nika, Danielle, Mariam, and Sofo, they printed out pamphlets with information of HPV vaccination with in Georgian and in English, and they gave it to
Perfect.
primary care doctors. So, so maybe in a few years from now, we'll have a much higher.
Maybe population.
Yeah. Another question,
So
one question I
and
wanted to ask you is, you deal with giving bad news almost very, very high rate compared to most other doctors. And I can't imagine how that's like. So could you tell us a bit about your experiences, good or bad?
yes, it's pretty difficult. Like, and you saw me how I hard during these problems. Unfortunately, in Georgia, we have not psychosocial support of the patients.
Right.
Only one think it's help us, it's family and relatives. And I know that you know already in India it's the same surrounding, and relatives help, but sometimes it's opposite. It's like wall between us and patients, and they avoid to give them true. But I did my best to explain to the patients, and it's my fail, and it's a great problem to tell the patient, and you will die nearest several months. But I tried to explain them that condition is pretty severe.
Right.
I do my best to help you, and we have several options: help you to support and to palliate your symptoms and improve your quality of life, or treat you without success, but add a lot of adverse events. And we should be in the same side to fight against the cancer.
Right.
But step by step, I
It's a
improve
long
my,
process.
yes, and because I am pretty sure that we must give to the patients full, true information, because otherwise we miss the chance for the patients to do uh, last wishes.
Yeah, right.
Because otherwise, if we give to the patients the um, false hope, maybe they delay their wishes for future, and
Right.
in real life they have no any future.
Right. I asked you a question before I invited you to this live stream. I asked you a question, and you had a very interesting response. I asked you what was the main reason you joined oncology, and then you said, "Yeah, I want to think about that, and I also want to think about what made me stay in oncology for so many years." So, in your words, could you tell us why you remained in this field for this long?
Yes, I am. I started my medical experience from very beginning in 1991, when I was pretty young as you today. And first, my real patient was first patient with AIDS in Georgia.
Right.
And I was Nia, if you hear about the Ting
Yes,
now
I
who is
have.
managing our yes, COVID infection. I was the one of the his um, students, like that.
Infectious
And
disease.
yes, it was the first aid. It was the immunodeficit and aid center, medical
Mm-hmm.
center.
Mm-hmm.
And first patient was mine. I did my best to survive them, but all of them, the first patients, because that time we have no any effective antiviral drugs, not
Mm-hmm.
only in Georgia, in whole world,
Oh,
and they all are already died. Then I moved to the hematology. It's a most dangerous specialty in my life, because the acute leukemia, that time 20 years ago, without transplantation, without immunotherapy, without target therapy, it was absolutely impossible.
right.
And all patients whom I give my heart, and they are already alive, they are my candles in my life. And then I continue in oncology, because it's most wide, and I am happy. And
Thank you so much for sharing
if
all your
I,
experiences with us.
yes, and if I return to the back, I choose my specialty same way again.
Thank you so much, Dr. Nia. I truly admire your courage in doing everything you can for your patient. Thank you for
Thank
joining
you.
us today, and I
Thank
look
you,
forward.
Lekam.
Thank you.
Thank you. Bye.
So that was Dr. Nia. She had so much great advice and wisdom and insight to give us about oncology. And now I want to introduce someone who I recently acquainted myself with, Dr. Tiko Muradashvili. She is associated with USMD as a lecturer. She is a resident now. I would like to invite her to tell you the rest. So, hello, Dr. Tiko. And hi,
Hi, how are you?
I am fine. You look amazing.
Thank you.
So,
So I changed my environment, that's why.
as
Thank
I
you.
know you're working from home, you have very little time for us. So I'm going to keep this as quick as I can.
I'm all
And
I'm all free right now, so
oh, perfect, awesome.
yeah.
Could you, so everyone listening, could you just introduce yourself in a couple of lines?
Yeah, so this is like Tina Tin, but my friends, people call me Tiko or Tina. What they prefer, Tina is kind of easier for international students, so that's why sometimes I was introducing myself as Tina. So I graduated Tbilisi State Medical University, and I decided to take my step, and I passed them, and I pursued my career into hematology oncology in Georgia, and because I wanted to continue my studies in the United States, so I came here. I took internal medicine, so I'm now in residency.
Awesome. So you're in your second year of first year of
No,
residency?
it's just the first year. I just started.
Wow.
Yeah.
So how has your first year been so far? Because you started recently, and now there's quarantine and everything. So how has it been?
I know. So we had a lot of problems because of COVID-19, and because of that, there were like some issues about visa, but everything like went well because of this pandemic. So we have these online courses. So I think we are doing great right now. But of course, it will be better to have some like more better orientation in the hospital. But I think still works like this, at
So
least for orientation.
so could you tell us like which hospital you work at right now?
It's Yale New Haven affiliated hospital in Waterbury. It's a not big program. It's a small community program, but I think very popular, and we receive a lot of patients, and I think it's going to be great.
So could you tell us what kind of patients you see most often? Like what pathologies do you mostly see with your
Like here in Waterbury, so it's kind of hard to say that, but from what I've heard from my friends and from the doctors, they see very like very even very rare diseases. So the range of these diseases is pretty wide. They say like Whipple disease, and they see Connecticut. It's very common for Lyme disease. And they see a lot of like different diseases, the same what happens. But of course, because of this area, there are like some diseases more common here, like Lyme disease. So
So
yeah, we need anti.
what made you curious about hematology? It's like what how did that happen?
I think everyone has a mentor in your life, or someone like professor or a friend who inspires you. And for me, I think when I came here to the United States for my practical experience, I went into hematology department, and I saw like doctors, and I saw one mentor who really inspired me. So um, he was pretty amazing. I was so like shocked when I saw his practice. Um, like his differential was so wide, and we were like seeing so many patients, so many interesting patients. So that was probably the impact like he made on me, and that's why I decided to just try things on.
That's the
Um,
first time someone who's come here has said that, and that's amazing. So shout out to this doctor who inspired you to take
yeah,
up hematology.
I
I
think that there's always someone who just like pushes you in a like certain way. So when I saw his practice, that was like very amazing for me, and that's why I'm gonna try this. And I was also attending some like conferences, and I saw what kind of differential I can meet in hematology. So I think it's very, very like various condition that you may meet, and that's why I was like, that is very truly amazing for me.
awesome. You also do something even more awesome, which is teach biochemistry. How did that happen?
Okay, so I was only the third year of my medical school when I decided to take USMLE steps. So my first subject was biochemistry. So I
Classic.
think yeah. So I think there were like different approaches for the time because it was around like not 10, like 7, like 6 years ago, right? And now you have a lot of like source of information, but for that time it was really hard to find someone who who took all these like steps and to like get the information what you need. Um, so there was like one approach that you had to like take this like big textbooks to like prepare for USMLE steps. So I started reading biochemistry like dabbling.
Oh,
So to be honest, I really love that book. It was pretty amazing, and I did really well. I was very motivated, and I'm trying to find that motivation that I had for the time. And I could like spend like whole day, reading like biochemistry, and um, not even once, I was like going back to some like topics to see to recall, what was there.
have a separate session with you where you get to like refresh all my biochemistry before I graduate. So yeah, I'm going to call you if I ever have any.
Yeah, so like when I was like reading one chapter, I was also reading some other books from like certain like for specific books for specifically for USMLE exams. So that was like very like crazy experience, and I fell in love in biochemistry. I can say that. And that's why, because I got this experience, I wanted to share with someone. And I'm glad that I had opportunity to share for USMB students.
That's awesome. Thank
Yeah.
you so much, Dr. Tina Muradashvili, for joining us today. It was great talking to you. Is there any advice you'd give someone who's on this journey to residency?
Yes, I think I can share. I think I listened to some other doctors or students who took these steps and are on this way to U.S. residency. So I can give you advice like a little bit about like what you can do if you like graduate from your medical school and haven't done any clerkships and you still want to like continue your career in the United States. I think did you talk about like observerships or the
No.
medical experience you can get? So I think this is very important. So I always like advise to my students and to others who ask for this that you better take, you should like find clerkships and you should take like step one when you're still in medical school and then try to find any clerkship opportunity. But you still have some options if you graduate and if you still want to go into U.S. residency. The first step is to find supervisor. I think there are a lot of like people, even like Georgian doctors or even like other doctors who you can just like approach and like address their emails and ask for sponsoring for observerships. And when you I mean, it's kind of hard, of course, but you still can find like someone who will trust you, and will sponsor your observerships. And you can grab your recommendations from your shadowings, and then you can just take this letter into your application for the residency. So if anyone is interested, they can just definitely free contact
You
you.
also work at one of the biggest you also had some experiences at Winship, which is one of the biggest cancer institutes in the US, right? You had a short time there
Yeah,
with Dr. Nia.
I was honored to be there, and I shadowed like really amazing doctors there. So I had shadowed before in Yale New Haven Hospital, and I also shadowed at Winship. So I think there are like different, different culture and different style and different system. Um, so what I want to say, when you decide to go for shadowing, just not only knowledge, sometimes like knowledge on not is not the only thing that like helps you to go through this. Of course it's very important, but I think medical ethics and the way how you communicate with doctors or some like physicians or physician assistants or anyone there, it's very very important, because I think at Emory Winship Cancer Hospital, they were more oriented and focused on how communicable, what is your medical ethics, and how you communicate with your like peers or doctors or even even in check tests. So that's very important. And then, of course, if you have a chance to show your knowledge, yeah. But sometimes you don't even have chance, to like show what you know or something like that.
Right.
So try to be very
Proactive.
careful. Yeah, active, proactive. Of course, you need to be active, but not too active. You need to like find some balance
Yeah,
with.
you need to know what you need to work on, like what you need to know, find more knowledge about.
Yeah,
Yeah.
yeah.
Thank you so much for joining us today. This is so great talking to you. And
Good.
I actually didn't personally get to do my clerkships in the US this year because of it was planned during the summer, and due to COVID, they were all canceled at the end of the year.
I know.
So I think I might be looking into observerships after I graduate, and I will definitely keep what you said in mind.
Yeah, I mean, you can still find some hands-on experience. It's just very hard to find
Yeah.
um, the hospital or someone who will allow you to do that. But everything is possible. You can still go for it. Of course, hands-on experience works much more than observerships because it's like you just like go and do your physical exam. You make like some patient notes when you have like hands-on experience. But during observerships, you're not allowed to even touch the patient. And yeah, sometimes in some hospitals let you access the system, patient system. For example, at Yale, they let me do this, but at Emory, you are not allowed to, even go to the patient charts. But if you like find someone who trusts you, you can just like ask someone that could you like please like share the information you have for this patient because I'm very interested about the diagnosis and this kind of things.
Thank you for all your advice and all the insight you shared with us today. And I will talk
You're
to you.
very welcome. Thank you.
Thank you. So that was Dr. Tiko, and we have another interesting person, Dr. Vakhtang, also known as Waffle. I met him during a very interesting conference that he helped organize. Without further ado, Dr. Vakhtang Tebidze.
Hello, Lekha. How are you?
Hello, hi. So
Hi.
I want to give a little introduction about you. You are a jack of all trades. You've done so many things in a very short time. You were in medical school and you were the president of a very interesting scientific community. You promoted a lot of conferences and discussions in science, especially in English, and you also have a lot of international students following your work, which I personally am very grateful for. One of the first conferences that I got to attend was the global health,
Yeah.
which was conducted. That was very interesting. And could you just tell us a little bit about yourself and what? Just tell us a little bit about yourself.
Okay. So thank you, Lekha, for your introduction. So I'm Waffle, Vakhtang Tebidze. I graduated Tbilisi State Medical University in 2018. Currently, I'm doing masters in public health in TSMU. So now I also work as a clinical research associate at a French research organization. Also work at East European University as a manager and a lecturer of the healthcare faculty. So I'm also a president, as you said, of the independent non-governmental organization, Youth Scientific Union, YSU for short, which aims to promote science in society. Of course, medicine is the main working area. So when I was a student during the last year in TSMU MD program, I worked at the International Humanitarian Organization, Doctors Without Borders, which was a very good experience for me. So that's a short introduction.
Right. So, what brought you to kind of decide? Okay, I'm in medical school, but I want to do something more than that. I want to promote science I want to make a scientific society. How did that idea come into your head?
So actually, it was not only me who had this initiative. There was a group of my friends, amazing uh, people who had the idea and who was seeing our environment that the students, medical students, needed more opportunities to express themselves, to get non-formal education, and there were some. Of course, some societies who were giving us some opportunities, but that wasn't enough. So we decided to make these opportunities by ourselves. So it was 6 years ago, and we are now
And
uh,
going
doing it. Yeah,
awesome.
6 years and counting. Yeah.
I actually, although you haven't had as much experience in oncology, the
Yeah.
reason why I wanted you here today was because you organized quite a huge conference in 2019 called Onco 2019. It was in 2019, right?
It was in the first one was in 2015 up
Okay,
and 2017.
right. Sorry, my bad.
Yeah, twice.
And how did that come across? Why did you choose? Why did you decide with oncology?
So I was when I was a student, like a third year student, and studying pathology, immunology, the cancer development, genetics, and so on. I got very attracted by this field, how interesting it was, how and how it was developing, how rapidly it was growing.
Right.
So, and that was a period when I wanted to become an oncologist. Um, so, and with my friends, we decided to. They knew also my wishes, so we decided to why not to make and organize a conference about oncology. So, and we set like our group, our team, we set and were discussing some ideas how to make it bigger, and finally we made it. It was for that period in 2015. No one would imagine that it was possible for the students to organize
Huge.
a conference and involve the students from all the universities in Georgia. So it was a big challenge for us, and we had a lot of obstacles and a lot of barriers that we had to overcome. But finally, it was a enthusiasm of all the team members we had that we made it.
That's amazing. I find that very inspiring because along with like medical school, it's already hard. You went out of your way, organized a group of people, and did this. That is credits to
Yeah,
you.
yeah. Thank you.
So you've also had a bit of experience abroad, as I know,
Yeah. So in oncology, you mean
yeah,
probably?
or just in general, like any medical experience
Yeah.
abroad.
So yeah, mainly it was about oncology. So when I
Okay,
was a student, as I was trying to use all the chances to participate in some conferences or in the meetings to get more knowledge about this field. So, and I was very lucky in 2016 when I got selected among 25 students from different countries. It was the courses for medical students organized by European School of Oncology. It was multidisciplinary course for 2 weeks. So there was a scholarship for almost all aspects of the course except travel, and the travel was funded by TSMU. So the courses were amazing. There were some world-class oncologists delivering lectures like Dr. Vermorke and Dr. Shivers and so on. And I would recommend all the students who are interested in oncology, all the medical students, to try this and apply for these courses. It will be very, very useful for them.
very interesting. So what made although I do appreciate how important public health is. What made you change from oncology to doing a master's in public health?
Yeah,
We are living in a public health crisis right now, so your job is very important.
yeah. So, yeah, there's something happened that made me change my choice in oncology. So, I didn't want to go to USA or into Europe for training, but I didn't even like the idea of doing residency in oncology in Georgia, in our country, because the way the residency system works here in our country was not acceptable for me. There are a lot of things to be improved here. So I was more interested in generally in clinical research and in organizational things like in NGOs and so on. So and the idea of public health, is it's a science and art of preventing diseases.
Right.
So it's very attractive, as not less attractive as being a doctor. So if when you are a doctor, you are treating one particular types of diseases, but when you work in public health, you are working on the well-being of the whole society, their physical, psychological, and social well-being. So that was very attractive and interesting.
Actually, we recently had a 2-week lecture with, you might know him, Dr. Vakhtang Tebidze and Moniaga. They're public health professors. They were talking about, and I've just been so interested in public health, and because because of the number of people you kind of can affect, right, by good policy and organizational skills, and just preventing diseases, which is a lot more important at the end of the day than
exactly. You mentioned also you mentioned HPV vaccination. You mentioned a lot of oncologic diseases which can be prevented by proper public health policies. Yes.
You've also done something very amazing, which is you had an experience with Doctors Without Borders.
Yeah.
So I feel like a lot of medical students kind of have that dream of, participating in something like that. So could you tell us a little bit about that?
So Doctors Without Borders had been working in Georgia for 20 years. So the project was closed very recently, but it wasn't the same way Doctors Without Borders work in Africa or in Asia or any other country. It was sort of office work. Mainly, our mission was conducting clinical trials in TB patients, treating multi-drug resistant TB. So, and when I was a student, and there were some new medications that could be effective in case of multi-drug resistant TB. So, and as a student, I had the opportunity to work as a translator during this period, and I was translating some medical documents. And but seeing how MSF works and how this big international organization works was very good experience for me.
So you kind of already laid out your trajectory to public health, starting from YSU, then your experiences with this, and now doing a master's in public health. What advice would you give someone who is interested about joining public health, or what kind of a person do you think belongs in public health?
I think the way I ended up in public health was very effective for me and very good experience for me. So if they were more active in conferences, like during being a student, going abroad, seeing how the systems work in other countries, and in trying to work in some big international organizations, or at least following them in social media or in their websites, and to get some idea how they are following their purpose. So I think this the way I reached public health. I think it's a good way to go through.
Thank you so much, Waffle. You've shared so much today. Is there anything else you'd like to add to that?
No, but I would like to mention that you are doing a very nice job. I watched some of your episodes and you are doing it very well. So congratulations.
Thank you so much. Yeah.
Thank you.
Good luck with everything. I hope to see come back to Georgia and see you as a very prominent member in public
Yeah.
health. I want to congratulate the country for already doing a pretty decent job
Yeah.
with COVID-19, and I think it's only forward from here.
Yeah, I hope so. So I wish you good luck in your career after graduation and in
Yes,
your goals. Yeah. Thank you.
thank you. Bye.
Bye.
So that were three very interesting people who spoke to us about different aspects of oncology and hematology and even public health. And I hope you guys got a little bit of knowledge or insight or ideas about how to move forward in this field. Tomorrow we'll be talking about it's called First Aid Friday. We'll be talking about everything related to medical school and the USMLE. Thank you so much for joining in today, and goodbye.